methods to be getting lower scores in statistics. Those who are getting high scores in research methods to be getting high scores in statistics. So there is another variable, but these two variables are associated because there is a common variable which is influencing this. So never interpret correlation as causation. It's just association. Clear? There is another type of research design which is referred to as case studies, and sometimes you can also talk about single subject experiments. This one I want to watch you people to watch me, because very often you are very fond of saying, I want to assess the problem of street kids, a case study of Ulirongwe. You are lying. Okay? Case studies are a particular design of research. Case studies relate to studies where you are looking at single individuals or discrete groups of subjects. Listen it. If you take, for example, a medical scientist, he has received a patient at the hospital suffering from a rare disease. One patient coming to the hospital, but the disease he's suffering from is not as the other common diseases, you know. It's not like malaria. If it is malaria, they will come in large numbers. But this person is only one person. I'm having a peculiar headache. It's just giving me pain on this corner of my head. The rest of the head is okay. Now the medical doctor has a challenge to say, what kind of a disease is this? What kind of medication can I use to treat this disease? It's a rare disease. He can engage in some experiments to say, oh, maybe if I administer this drug, the patient will be treated. And he sees whether the person recovers or not. If he has not recovered, he changes the drug, he uses another drug, and so on. This person is conducting experiments on that one single case. He wants to see which kind of drug can treat this disease. Or he wants to assess what kind of microorganisms are causing this disease. So he can actually be taking samples, measuring them in the laboratory to see what microorganisms, and you'll be testing this microorganism. No, it's not that one. Testing for this. No, it's not that. Testing for that until he discovers, oh, it is this microorganism causing this problem. That person is conducting experiments, but those experiments are involving one single subject. When he comes out with results from such a study, those results cannot be generalized to other people. He has only studied one case. So he will describe that case in detail. If in the future somebody experiences a similar problem, now they can go to this case and say, how did that person find this case to be like? What were the kind of microorganisms? What was the treatment regime he used to treat this case? It's a single case experiment, and it can be referred to a case study. And you can do the same if there is a rare disease has broken out in a particular area. We had a case some 2-3 years ago where actually it was typhoid problem, but it occurred in the Neno district, and the medical doctors did not understand it. I can assure you, when they went there, the first thing they did was to assess what kind of disease is this, only affecting Neno. And the people who are suffering are showing the same kind of symptoms, but they are very rare symptoms. So they could refer to that as a case study of that area. Because it didn't happen in Mansa, neither did it happen in Dwanta, it didn't concern in Shehu, it was in a particular area. Then you can talk about case studies. But if you have chosen to do a study in a particular area, not because the situation is different from other areas, but because you are sampling that area, that's not a case study. Okay? Have you heard me? If you study if you conduct a study in one area, not because the phenomena you are studying is only peculiar to that area, but because you cannot afford to study the whole Malawi, so you have decided to sample Mchinji district. Don't tell us that you are doing a case study of Mchinji. Whatever you will find is about Mchinji. So you should just tell us, I'm conducting this study, I want to assess this thing in Mchinji. Somebody can do the same in Ideza. Somebody can do the same in Nsanje. It's not a case study. But when the case you are studying is peculiar to an area, then you can talk about a case study. Okay? And when you are doing it peculiar, what do you mean by peculiar or unique? He has given you the answer. Unique. The example I was giving, like a patient has come to the hospital suffering from a rare disease, a disease which is not common. Now the doctor is trying to assess what type of disease is this one. So he conducts experiments by taking samples from this patient to assess what kind of microorganisms are causing this disease. That's a case study because it is a unique case. It's a peculiar case. And the interest of such a scientist is to describe that case in detail. Whatever he has learned, he needs to describe it in detail, in depth. Okay? Then you are doing a case study. Other questions? So that's about case studies or single subject experiments. You can also do studies. Now, this is a methodology. Ethnography is another type of research where your interest is to study a cultural phenomena in its entirety. And most commonly, this type of studies are done by anthropologists who would have questions say, when people are talking about witchcraft, what are the sort of things they engage in witchcraft? I want to go and study witchcraft and describe what happens amongst witches, what they do. I don't think you can go and conduct a survey. You will not get an answer. And you have given the right answer as if you are joking. The best way for you to do the study is you should also become a witch and practice. Not because you want to be a witch, but when the witches are doing their practices and they know that you are also a witch, they'll be willing to reveal what they do, which they cannot reveal to non-members of their group. You go to an area, you want to learn about the Bure Wankulu, right? If you go with a survey, will they tell you what they do in Bure Wankulu? No. You have to become a member. And as you are participating with them, you describe what is happening. That is what? Ethnography. So when we are talking about the research design, don't just say descriptive or experimental or quantitative. There was specifically what? Because we have talked about so many designs. Right? So ethnography will involve continuous observation, or you should participate as a member of that group you are studying. Participant observation. You can use non-participant observation, but it requires extended time in the group. Questions? I think we can stop there. Yeah? Oh, sharing areas of concentration. Anything covered after mid-semester. Yes. You are making noise. Somebody asked you a very good question there, but because you are making noise, you are denied of participating. Areas of concentration, anything after mid-semester. Yeah? If you look at my slides on when I was describing proposal, I described the chapter 1, problem statement, background, objectives, and literature review. And if you go back to your exam, I stopped there. But anything about methodology going onwards, that can come.
Yeah, that can come, Baba.